One of the nurses would be like, "You want to scout me?" So it was just like a group effort. So my name is Tasha. I'm originally from Austin, Texas, and my undergrad was at UT Austin. I majored in neuroscience as an undergrad. I found speech pathology. I decided to add that as another major in undergrad and absolutely adored it. It was the combination of everything that I love, which was the analytical side of learning about how communication works scientifically, and then also exploring how to really change people's lives from a clinical perspective. What drew me to Vanderbilt specifically was the expansive resources that students had. Not every program has, a state-of-the-art research institution and also medical campus where students are directly placed on floors, one floor away from their actual classes that they're taking. And then also, being in Nashville was a huge draw for me, especially because I was interested in doing voice. I knew that I wanted the experience of patient care that would apply to singers and professional voice users in this city. And so I was really intrigued by the Vanderbilt Voice Center, and I guess at the end of the day, the program itself was a huge draw, but also its partnerships were really, really important to me. And I feel like I really wouldn't change it any other way because of how incredible the class, clinic, and research kind of triad was. I think it's really cool because this program has options for tracks, but not everyone's on it. So you have the opportunity to opt into it. My mindset going into graduate school was learn everything that I can as early and often as I could. And so I chose to go onto a track for pediatric hearing loss, and I've absolutely loved it. The reason I chose that over any of the other tracks, or not any track at all, was because I knew the least about hearing loss coming into this program, and I felt like that was the best way for me to maximize my time here. I have absolutely adored not only the track, but also just how much I've been able to learn and see what collaborative kind of care looks like. Being able to see at the academic level how interdisciplinary collaboration works excites me for my career ahead, where I can really put that into action and apply that, even if I'm not necessarily working in the pediatric hearing loss space. From the get-go, very first semester, we are placed into clinical rotations, and as we continue throughout the program, we have more and more clinic days and fewer class days, so it kind of balances out as you get more and more experience in the clinic. I really appreciated that because it allowed me to gather clinical skills over the first few weeks. And then as I felt more and more comfortable in the future semesters, we eased our way into more unfamiliar clinical spaces. So we started out more familiar with pediatrics, which is something that I had experience in before. And then as we worked our way throughout the program, there were more clinic days and more kind of new experiences within clinics. I think that really helped me get not only the clinical skills for each setting, but also compare and contrast throughout the week how I was feeling about each setting. And do I like this aspect of a setting more, or do I like this population? Do I connect with these patients a little bit easier? And so that kind of helped me throughout the program kind of see how I was feeling in terms of where I want to go and what I want to do. I really like that as well, because the emphasis of the program's clinical rotations is to give students access to clinical experiences across the age spectrum. And so going from all the way little itty bitty babies to the oldest populations, it really helps give context to how prevalent communication disorders are throughout all lives, and how speech pathologists have like such a crucial role at every step of the way. The goal of the externship is to get students to be as independent as possible as they can within a 10 to 12 week period. For me, I was at the Vanderbilt Voice Center, but other students were able to go outside of Vanderbilt, hence why it's called an externship. It has the opportunity for people to find a new setting or an environment, especially in a place that they're starting to really want to work towards. So for me, I knew I wanted to do voice, so I wanted to get special full-time training in that setting. But throughout the externship, I worked with my two supervisors to create a plan of how to get me independent in every aspect of that role. So I was basically learning directly from these supervisors, doing that therapy, doing evaluations directly with patients. And from week 1 to week 10, there was a drastic change in not only how much independence I had working with patients directly and treating them directly, but also how much confidence I had in my clinical skills. So that was multiple different aspects that we were working on to kind of get me ready for graduation. I would say Dr. DeRiesthal, he is just beloved in the department. He taught our aphasia, TBI, and motor speech disorder classes, and just has a really important presence not only with the students but also within the department itself. So he previously worked at Pi Beta Phi as a director, and just his experience, his perspective in speech pathology, and also his kind of contributions to research have been so amazing. But what's really, really meaningful to me, I think, about Dr. DeRiesthal is he gets to know every single student. He knows them by name. He asks you how you're doing, just even passing in the hallway, and will take the time to really get to hear how you're doing and how you might be struggling and might need help. And I think he's an example of how the faculty here are so supportive and thoughtful. And so there will be times where he comes into the student lounge just to fill up his water, and we end up talking for 30 minutes about, you know, how my interviews are going or how his classes might be running. And so it's just so exciting because I really feel like he just encapsulates like speech pathology as a whole and his support for the students. So my background was neuroscience. So my graduating class in undergrad was like 500-600 people compared to this class, which is significantly smaller. We have all of our classes together. So we go from class to class to class and see each other literally all day. And I think that was a great opportunity for us to kind of, again, explore interacting with different personalities and also really appreciate what each other loves about speech pathology. Because every single one of my classmates wants to do something totally different from the other. And I love that. I think it really shows how diverse speech pathology can be. We're all friends and we're all really, really proud of each other, because if no one else gets it, like my classmates, they understand the struggle of balancing school and clinic and life in a very, very transformative time in our lives. And so I think having people who not only understand but really, really support us and are actually friends is such a big part of what has made this program so wonderful. At the Voice Center, there's kind of instrumental sides of evaluation that requires a lot of kind of confidence and also skills kind of going into evaluating. So my supervisors from the start of my externship asked me what my goals were, and one of them was, I absolutely adore video stroboscopy, and it's something that I want to try to hone and learn as much as I can while I'm here. And so they said, okay, done. We're going to try to get you to, work closely with patients and be able to, scope patients as soon as we can. And so we, the supervisors that I had were phenomenal, and they let me scope them until I felt comfortable with doing it myself. And I thought that was just such a testament to their kind of dedication to my learning. Within a few weeks of my externship, I felt confident and excited to try that myself. And so I was able to work with patients directly, doing video stroboscopy and running both kind of sides of the evaluation. The next step of after graduation is a clinical fellowship, and I am super excited. I'll be doing a clinical fellowship at Northwestern in voice. Not to toot my own horn, but I think that the perspective that I had going into this really served me well, and that is take advantage of every resource that you have. Whether that be this specialty track or doing a thesis or whatever, the staff are there to kind of support you. The clinicians are just phenomenal people to work from, and so I just feel very, very lucky that Vanderbilt, as a whole, in every realm, has been such a big part of my learning. So yes, I would say take advantage of every resource that you can within the program.